Welcome, everybody. I'm so glad that you've joined us. This is a panel entitled the COVID-19 LGBTIQ Emergency Fund in Asia, Stories and Lessons from the Front Lines, just to make sure you're in the right place. My name is Ami Bishop. I'm a global health and human rights consultant and currently serve as Outright Action International's senior research advisor. We have really a wonderful panel for you today who are going to each going to share their stories with you about their experiences as recipients of the LGBT COVID-19 Emergency Fund. Just quickly, a couple of notes before we get started is I encourage everyone who's attending to please introduce yourself in the chat. Tell us who you are, your pronouns, your affiliation, where you are. And then throughout our time, please do feel free to post questions in the Q&A tab as we go along. And we're hoping to save about 15 minutes towards the end to respond to your questions. And hopefully we'll get to most, if not all of them. So with that, I would like to introduce my esteemed colleagues here. Actually, I'm going to ask them to introduce themselves very briefly. And I'm going to hand it to Leslie first, please.
Hi, everyone. My name is Leslie Ampoan. I am a member of Lesbian Organization Against Violence and Inequality. We are located in the Philippines and we are focusing on LBTs. We do a lot of help and support with the LGBT sector, and we help them to create projects needed for them. Thank you.
Thank you, Leslie. Vivek?
Hello, everyone. My name is Vivek Anand, and a very, very good morning from India. I work with the Humsafar Trust, which is Companions on a Journey. We are India's oldest LGBTQ. We are the first LGBTQ plus organization in India working on the health and human rights of the LGBTQ plus communities in India. So very happy to be here, and good morning again.
Thank you so much, Vivek. And Mitch, please go ahead.
Thank you, Ami. And hello, everyone. I am from SEED, the first transgender-led community-based organization in Malaysia, where we provide access to safe space, support sustainable livelihood, access to healthcare services, and a platform linking our community to resources that will improve quality of life for transgender community in Malaysia. And we also established the first shelter home for elderly trans people in Malaysia. Thank you, Ami.
Amazing. All of you are doing amazing work. And I just wanted to remind our audience that below your screen, you can read the full bios of each of the speakers, and you can also reach out to them if you wish through the feed loop speakers section. You can private message them if you wish to follow up on anything that you hear today. So what I'm going to do now, I'm just going to take a few minutes to provide a bit of context for this session. As some of you may know, very early in the pandemic in 2020, we undertook a rapid assessment of the impact of COVID-19 on LGBTIQ people around the world. And this was published in May 2020. The findings, quite frankly, so early in the pandemic were startling. And since then, many of our findings have sort of continued to be corroborated by subsequent research, which really shows the rather devastating and disproportionate impact that the pandemic is having on many of us within our communities. And what we realized at that time was that our communities around the world needed immediate support. And the reality that we came to really was that if we didn't step up, such support really may not be forthcoming soon enough, at least not for a while. And so at the end of May in 2020, we launched the Global COVID-19 Emergency Fund. I'm just going to show a quick few slides to give you a bit more context about that fund. I've also pasted in the chat a link to that research report that we published in May 2020. So I'm going to just quickly go to my slide deck here. Okay, I hope that is visible to everybody. So this is just a quick review of the our global COVID-19 Emergency Fund. What I want to emphasize is we received, when we did several rounds, we did our first round in sort of May of 2020, June or so. In that first round, we were overwhelmed with more than 1,500 applications worth about $12 million US dollars in requests. The next round was similar. And so in total, we received more than 3,000 applications from 131 countries. And we were constantly fundraising throughout this to fuel the fund, if you will. And we were able, up to this point, to allocate about $3.2 million in grants to, sorry for the typo there, to about 310 groups from over 100 countries. We estimate that about 145,000 people have been reached. And that is just, it's satisfying and gratifying that we were able to reach that number. And at the same time, we know that so many people were not able to be reached. The nature of the requests that we received really spoke clearly to a burgeoning humanitarian crisis among some of the most vulnerable communities around the world. This next slide just gives you kind of a picture of for the round 2 applications. So earlier in this year, the allocation or the distribution of the type of requests that we received, and you can see that food and health needs comprise just about 50% of what the requests were, which was interesting because the first round, about 56 or 57% had to do with food. But we see now in the next round that health needs were emerging as also a serious area of need. This is a geographic distribution. You could see that just over half of our applicants came from sub-Saharan Africa. Latin America was the next sort of largest contingent, if you will. In Asia, about 12% of the applicants were from this region, from the Asia region. I just want to note that we had an additional call just in October, and that call had a specific focus on vaccine equity. And we have received in this round 260 applications, and they're currently being reviewed. And we hope that we will be providing a new round of funding in January. What was interesting about this particular round and this theme was that clearly through the applications, we saw that there are significant vaccine access barriers. So even when vaccine is available, and we know that that's, even availability for anybody is an issue in some places, but even where vaccine is available, there are barriers, especially for transgender persons whose gender markers, for example, may not match. And also, of course, due to stigma and discrimination. And also, we were hearing through the applications quite a bit about some of the misunderstandings and mythology around the vaccine. And we know that that's actually a unfortunate reality around the world, many rumors, but specific rumors that some of our community members seem to have heard about the vaccine being actually dangerous to our community. So I'm gonna stop there, and would like to now move to our esteemed panelists. And what I'd like to first go to for each of you, and I think I'll start with you, Leslie, is each of you have applied and received funding from the emergency fund. And what we'd really like to understand and hear from you is what led you to apply for the funds and sort of how you determined what were the most urgent needs, what were some of the challenges you faced, and what were you able to accomplish with the funds. So Leslie, why don't you start us off? Over to you.
Thank you, Amy. COVID-19 response in the Philippines is very slow, and they also focus on families, senior and solo parent. But when it comes to LGBT, we don't have any fund yet. The Philippines provide help in terms of money assistance and groceries, but we are not able to get them because we are not considered as family. We don't even other government and local LGU think that we don't need them because we only live by ourselves. Uh, that's we came uh, that's really made us to create proposal because we cannot reach any help here in the Philippines for LGBT sector. Because of this fund, we are able to give our members based on urban poor areas help, livelihood help, and we are able to give them work and support for the food and for their families. Actually, the challenges we face here in the Philippines for LGBTIQA plus in urban poor areas, we don't have access on vaccination sites, uh, which is number one requirement when you go to work here in the Philippines. When you go to work, when you go outside, you must be vaccinated. But because we don't have enough access to that, we cannot go out to work and provide for ourselves. And this fund really helped us to provide for the members. Most of our members did not finish schools and studies, and most of the affected areas in here in the Philippines are small industries. Uh, because small industries can't open because of the pandemic, majority of our members don't have work to provide from themselves. Um, Actually, this fund really helped us for the members to provide from themselves, and also they were able to get and establish their own small businesses to help for their families and provide for everyday needs and payments for utility bills. That's all. Thank you, Amy.
Yeah. Oh, thank you so much, Leslie. You raise a really important point that we found also in our research is that because so many LGBT people work in the informal labor sector, that this sector was really hard hit, has been really hard hit during the pandemic, and that people were sort of falling into unemployment and inability to make a daily wage. And it sounds like that's a similar situation to what you're describing. So let me turn it to you, Mitch. Similar question about what led you to apply to the funds and what kinds of needs were you trying to meet?
Thanks, Ami. I mean, I think Leslie has said it well. During COVID-19, there were a lot of challenges, and it's the same for the transgender communities in Malaysia. In the country where our existence are not recognized, transgender persons were not able to access support given out by the government. Mm-hmm. It all boils down to the fact that we don't and cannot trust our government. What would happen when we go and get that assistance they provide? When they see us, when they know where we stay from our ID registration? We could be arrested, maybe not immediately, but it can happen as they now know where we live. Mm-hmm. 70% of transgender persons sex work, and the others may have their own small businesses. Mm-hmm. However, during COVID, there was a lot of lockdowns. They cannot run their businesses. They can't sex work or even go to the clinics. there were really no way to earn.
Mm.
So at Seed, what happened was we received SOS from, wow, from all over Malaysia and as far as Sampurna Sabah. I personally saw an increased number of people on the street. I saw the hundreds of messages that our team received asking for just a bag of rice. They were not asking for fish. They were not asking for chicken or vegetables. They were just asking for a bag of rice to feed their families. At that point in time, of course, priorities are for our community. But if there's a call for help, how can we turn them down? And we realized that with the pandemic, yes, trans communities were very affected, but there are those out there, the elderly, the poor that are living away and are excluded from the society, they were affected too. And they are and can be parents or families of our community. So we help. We help those that needed help. Nobody gets left behind. We know how it feels like to be excluded. We did our best to not exclude anyone. Of course, there were challenges we faced. For example, there were more demand than what we can give. So we gave to those that asked, but since there were more requests, we have not stopped seeking for more aid. COVID-19 has left an impact on many of us. And although people are starting to work, but for our community and for those without that job, they are still looking for means to survive. Therefore, we will continue to assist the best that we can. The total number of distributions since January 2021 was we distribute to about 2,523 families, to which outright contributed to more than 550 trans persons and families. With that, thank you very much.
Thank you so much, Mitch, for that. You paint a stark picture of the need and the demand that you were facing. Let me turn now to Vivek Anand. Over to you. Let's hear from you and Humsafar Trust in India. You're on mute, Vivek. You're on mute.
Okay, so I'm listening to Mitch and I'm listening to Leslie, and I realize, why do we call this a global pandemic and how it has affected all of us across the globe? You used one term in your question, that why did we apply for this emergency fund? So emergency is the key word. Historically, Humsafar has not done relief work, but it was a call that we had to take. And it was sometime in March 2020, our Bangalore team leader, she got a call from a trans person saying that she's penniless, she's lost her job, and no shelter, nothing. So where does she go? And we didn't know how to take that call. So we came together as a team, and we said that it was end of March. So we said, like, let Humsafar teams make a contribution from their salaries, because the demand was urgent, immediate. It had to be attended. And we set up, this campaign, which was called Humsafar Fights COVID-19. And all of us contributed about 5% of our salary, and we raised our initial funds. And then we got into reaching out to communities. But once we went on the ground, I remember one of my team members had asked me that, Vivek, what are the monitoring indicators? I said, I have none in my mind. I said, we only know that there's a need out there, and we need to reach out, and we need to provide support. And what we are doing is right now, like looking for money to support our communities. Monitoring indicators will come along the way, and we'll work around it. And then we realized that, that first of all, the first experience we had was that the LGBTQI plus was totally invisibilized in the larger narrative. Nobody was talking about LGBTQI plus in India. It was almost like 30 years of our work had been invisibilized. We were nowhere on the, on the spectrum. We realized that especially trans persons, and when I say trans person, I say trans women, trans men, the non-binary, most of them had, like what Mitch said, I mean, either it's sex work or it's dancing, that's how they make money. So there was no source of livelihood, totally lost their money. There were severe health issues that had to be attended. People had mental health issues. And as we started this relief work, the number, so we had kind of set up this small, on the social media, set up a small form. But we also do a lot of outreach work with communities who do not have access to social media. And we had such large requests coming in from all over the country. It was, believe me, I mean, I have seen a lot in the last 30 years of my work, but it was overwhelming. It was almost a task, that at one level you are dealing with the situation, on the other level you're reaching out. So it was at that point of time, we decided that we need to reach out to all our friends. I have personally sat down and written 185 emails to friends if they could contribute anything. We just gave them our bank account. You could contribute anything. You could contribute like anything from, say in Indian rupee, it's 1,000 rupees. So it's probably like, $10. And whatever money you want. And believe me, Amy, I believe that, communities exist and communities hold hands, and people just started contributing money. And that's when Outreach Action International's call came. And believe me, like one of my team members was sitting and exclusively, looking for grants, identifying, writing proposals, because the enormity of the situation was so high. So that's when, and I'm very proud, it's not once, we have received this grant twice. And Outright Action International has been one of the largest partners that we have had in reaching out. It's been an amazing journey with them, but on the ground, the situation was like really, really tough for us. In the last 2 years, we have reached out to 44,000 individuals. We are providing them grocery support. We are providing them direct bank transfers to cover their rents, shelter support. We are providing them. So we have 4 counselors who are working online throughout the country. So we are providing them mental health support. Our volunteers have actually gone on the ground and made sure that the ART medicines are provided to people. Now they cannot come to our clinics and collect their medicines. Our volunteers have gone, they have risked themselves. And for me, it's a big salute to all the COVID warriors who worked with us relentlessly. And they continue to work even today, because the journey is far from over and the challenges still need to be met. So thanks.
Yeah, no, thank you so much, Vivek. And, I always have to, the scale of things in India is so much different than in so many places. And when you talk about, you alone having to reach 44,000 people, which in the grand scheme of more than 1 billion may not seem, significant, but it certainly is extremely important and significant to those people and to your communities. I wonder, we were saying before we actually got started that clearly we are all coming to grips as global citizens and each in our various locations that we're in a marathon. Clearly, this isn't a sprint, if you will. This is obviously going to be with us for one way or another for quite some time. And I wondered, how now as you look ahead and sort of the ways in which the pandemic continues to affect your work and your communities, and what are the continuing challenges that you're seeing. You've touched on some of them. I partly wonder if, are you finding support from other corners? Is more support becoming, kind of bubbling up and making that you can have access to? Maybe you could each speak a little bit about sort of now, what is the situation and how are you finding your way forward? Where do you see your movements going and your organizations going in this current situation? And I open it up, whoever would like to start to respond to that. Okay, don't be shy.
Leslie.
Okay, Leslie.
Leslie.
You're muted, Leslie.
Actually, COVID pandemic are still here in the Philippines. We always struggles on how we find work, support for our families, and also this season, this year, Philippines focus on elections, which also affect LGBT sectors. We are led to misunderstanding because some of the politicians use our situation, our needs for their um, own own um, own need to get to the politics. But when they are using our situation for them, but actually they don't help us. They only use us for their own good. And also we are afraid to do what we want because we are also tagged when we go against the government, when we say something bad about them, we are tagged as a communist, we are tagged as a rebellion, rebellious, and it's really hard for us to move. Um, we also we want to help each other, but we can find support for us in the Philippines. Thank you.
Thank you, Leslie. I mean, you're actually echoing a little bit a similar theme to what Mitch was saying earlier, is this really lack of trust actually with the government. And even if support could be made available or was being made available to other citizens, not actually feeling necessarily safe, or and I think that's a really important issue to highlight that we also saw in some of our research. Who else would, Vivek or Mitch, would you like to comment on this topic?
Okay.
Go ahead, Mitch.
Yeah, Mitch, please go ahead.
Thank you, Vivek. Many people say that the pandemic reduces the differences between the community. But what it does is it is also highlighting the biases in the system in assessing and obtaining basic support that is much needed. It has blatantly exposed the vast social, economic, and health disparities experienced by our community. Given the disadvantages by the community, one would expect that the damage to the economy will seriously impact our community, making it easier for us to fall further into poverty and into the cracks of society. Fundraising has been difficult because I understand that many are affected by the pandemic. And I think that is a challenge for us, as most funders have specific target focused, but we have to realize that we are barely scratching the surface, because the pandemic not only brought COVID-19, but it also highlighted poverty, discrimination, abuse, and like Vivek said, mental health aspect that most usually if we can. So yeah, that's from me, Amy. Thank you.
Thank you so much, Mitch, for that very sobering
Thank you.
summary. Yeah, go ahead, Vivek,
Yeah.
please.
Yeah. So, I mean, to be very honest, our challenges did not lie with funding because there is no door that we did not knock. So the traditional donor agencies, which really kind of didn't bother much, but corporate houses, uh, like, LGBTQ plus individuals are allies who came forward. And then, like, Outright Action International, which was actually like probably, so I don't know how do you qualify yourself as a donor agency but no. So that was like
Yeah,
one,
NGO. Mhm.
well, yeah, like I would say one agency. For me, you are a donor agency. But we got tremendous support from communities, our allies and corporates jumping in, giving us money. Uh, yes, everybody, except for community, I mean, corporates, they did have some targets, but it was targets that how many people you're reaching out to, which was kind of easy, which helped us put system. So our challenges were not so much about raising money, but our challenges were totally on a different level. Like say, we were working, we provided support in 19 states of India. So reaching out to, and we had no money, we had no administrative costs. We wanted volunteers. So there were committee-based organizations in the 19 states who had to be identified, who would send needs of the communities in their state, who would make arrangements for supply of groceries, finding out bank details and allowing us to do bank transfers. That was like, a huge task. Today, where we stand, I have a team of about 230 individuals and ensuring that as we get back to work, all our teams are safe, that they are following safety protocols. We've developed our own, like, our own guidelines. And we have been kind of, ensuring that as an organization, we remain fully vaccinated. But now that we are into the vaccination stage, one of the biggest challenge we face is to get vaccination for the transgender communities. Because in India, you have to register on a national portal. So eventually, like, we started raising funds for vaccines. And in our own drop-in center, in collaboration with the public healthcare delivery system, we set up a vaccination program. And that time we realized that there are so many people in the trans communities uh, who don't even have access to a mobile phone. So in India, you can use one mobile phone to register 4 individuals. So like I'm a trans person, I so we take one mobile phone and register 4 people, and then immediately take them for vaccination because that's when their first shot happens. And then they are given their next date to come for the second shot. But it has, I mean, it's kind of brought to my notice that I've always worked in our communities. I mean, I've never worked outside and I've seen marginalization. But such marginalization, the levels of marginalization that COVID-19 brought to my notice was unbelievable. One of the challenges we are facing, we are dealing with violence from families. The number of, uh, youth LGBTQ plus who were forced to stay at home during lockdown, and many of them, they couldn't call up any of their friends, they couldn't ask for any support, uh, they couldn't address their issues, were facing severe mental health issues. They were kind of forced outings where like you didn't want to come out, but it just happened. You couldn't deal with it anymore. And in India, we are like, you live together with families, so you can't go out, you can't talk to anyone. That has resulted in such tremendous violence. There is a trans woman who works with me, and we've always seen her as a trans woman, but now when she was in a lockdown, she was forced to wear men's clothes, which took a telling on her. We've made about 3 films of 30 seconds each. There's a story of a trans man like, who lost his job, had to come back home, is facing violence at home, dealing with this violence, getting these youngsters, filing police complaints, making sure that they get shelter. It's a huge challenge for us, you know. So our challenge is, very honestly, I didn't even have time to sit and think what the government is doing for us. I only knew one thing, that the call is at our door and we are going to take this call irrespective of support that comes from the government. Because obviously government machinery functions differently. They want identities for trans people. They want their documents in place. They may not have. Government did announce a scheme for trans communities. But how many of them got benefit? Hardly few. But I'm not interested in what's happening at that end. There was a call at my door and there were these challenges, something that I hadn't seen in 30 years. Believe me, having youngsters run away from home, and in the darkness of the night, in a lockdown situation, they would just call up. And how do we reach out? And how do we provide support? So these were very challenges, that access to communities. I had money. We raised almost close to $200,000. Communities really pitched in big time. People just called up, hey, Vivek, I want to support, saw your mail. So just whatever you would like to do it. So money was not an issue. Fundraising was not an issue, but access to communities and meeting challenges and dealing with the marginalization and the discrimination and the violence. And yes, in the end, the indifference of the state.
Thank you, Vivek. That's I think you've pulled in so many important themes, and actually themes that we also have come across in the research and in the many applications that we received. The increase in violence, the sort of forced cohabitation with unfriendly, unsupportive family or other family members that really lead to very severe mental health trauma and even emotional abuse, if not worse. And I think sadly that is a phenomenon that that many people are facing because of the need to either be in lockdown or to have, if they've lost their employment, being forced to go back to live with families of origin. I wanted to turn to you, Mitch, because I think some of the specific issues that relate to trans and gender diverse people having the ability, for example, and I don't know what the situation is now in Malaysia with access to the vaccine, but Leslie talked about people needing to be vaccinated to be able to be employed. That's becoming, I guess, standard. And Vivek, you are also talking about having now moved into the vaccination stage and trans people having such difficulty in many cases. Are you experiencing a similar phenomenon in Malaysia? Can you speak more about this topic?
Yeah, I mean, when we talk about, for example, vaccination, I think for SEED, because of how unimportant transgender persons are in Malaysia, we try our best to collaborate with whoever that wants to collaborate, so that in a way we are able to create an awareness. So during this pandemic, we were able to work with a government agency that provide vaccination. But we had a discussion and we said that, our community are transgender persons. And then during the vaccination, please do not call out their name. Maybe there is a way to do it through numbers or whatever, because as you know, our identification card, we do not have the correct gender markers. So let's not have that, maybe we want to vaccinate, let's call them according to their numbers. And thankfully they agreed. And we were able to vaccinate, I think, close to about 3,000 trans persons in the state of Kuala Lumpur during that time. So I think that for me, it's not about pushing people or those who want to collaborate. Yeah, they may say they are the government. They want to say, hey, I am working with this community, but hey, they want to do it. If it benefit the community, I would do it for them. Thanks, Ami.
Yeah, thank you. Thank you so much, Mitch. Let me turn to you, Leslie, and also just maybe building a bit more on the issue of vaccination and what you are seeing. You sort of referenced the fact that it was difficult for people to be vaccinated, but can you say a little bit more about what the situation is in the Philippines for LGBTI people in this regard? You're muted.
There's a lot of misinformation when it comes to vaccination here in the Philippines, and government information dissemination is not consistent. So until now, many LGBT here in the Philippines don't have access and has not been vaccinated because of that misinformation. Okay, Amy.
Yeah, no, thank you. And also, I guess for Vivek and Mitch as well, are you experiencing this sort of a lot of mythology and misinformation as well? Vivek, go ahead, please.
Actually, that's what I wanted to come in for. That one of the biggest challenges that we are facing is to deal with the myths, the misconceptions that, and what you put in your presentation, that, this is vaccination is government's, way of killing us. And it is really, today we are in a very good space. We have got 4 clinics, across the country. We've got CBOs who have clinics. We are linking up with them, providing support. You just have to link up with the public hospitals, a government delivery system. They are very happy to link up with us. But talking to communities, dealing with the myths and misconceptions, telling them why vaccination is important, is very, very challenging. Today, we actually kind of go out of our way to get communities to come in for the vaccination health camp and talk to them. We have counselors sitting over there and talking to them and making them understand that, no, this is life-saving and not life-threatening. There's no risk to your life. In fact, just recently, about 2 weeks ago, we had made these huge posters which we wanted to put across our organization that we are fully vaccinated. And one of my trans team members, she said, no, I'm not going in. I said, no, we need it, So she said, no, when I had my first shot, I really felt very ill. And I know there is a conspiracy behind this. So I said, look, I'm not the right person to address this issue, but you're my team. You will go into the clinic, you will sit with the counselor and the doctor and talk to them, because I'm convinced that I need vaccination. So I went my double dose, but I'm not a medical person to make an effort to convince you. So she went there and finally she got herself vaccinated. Obviously nothing happened, but these are the fears that communities live with. So, you can fight the government, you can raise funds, but when you are dealing with the fears in the minds of the people, that becomes a huge obstacle. Yeah, thanks.
Yeah, no, absolutely. I think that's an incredibly important point, and it's born of from one's whole life of being mistreated and oppressed in various ways, discriminated against. Why necessarily would you trust an entity that has not treated you well? A health system, a doctor, a government, whatever that might be. I'm curious on that point, because Mitch, you told, it's actually quite amazing that you were able to mobilize and get people vaccinated. And what was the process of actually getting, I guess it was the healthcare workers or clinic, the clinic you were, how did you get to the point of them agreeing to, was that a challenging process or was it fairly straightforward?
I think misconceptions is everywhere.
Mhm.
The mistrust is everywhere. But I mean, living in a lockdown with no income, and it's the same as death, I guess.
Mm.
So having to go through a vaccination, and the fact that there are those that survive the vaccination and are able to go out and work and earn, versus the what they have heard about getting the vaccine. Hey, anyone is willing to go through the vaccine there is a if there is a chance
Mhm.
to live their lives.
Yeah.
Yeah.
No, that makes a lot of sense. I was actually also thinking about on the other side, like, was there a process of working with the healthcare workers to be willing to do this vaccination for the population, given, I mean, given the sort of status of LGBTIQ people in Malaysia?
I think for them, it was very much on achieving their indicators. It's all about achieving the numbers. So right now for them, I don't care. Just bring me the people. We'll vaccinate them so that, we'll get the numbers. We prove to the Malaysians that, hey, the government is doing something. We've achieved our target, and things like that. Because after all, remember, they are the new government. So they have something to prove.
That's
So yeah.
That's so interesting. Yeah. So it worked in your favor in this particular situation. Let me just pause here and say we've got about 15 minutes left. I really would invite participants, if you have questions, to please post them in the Q&A. I know our panelists will be very happy to answer. And while attendees are thinking about their questions, let me just step back a moment and ask one more. And that is really related to the ways in which COVID has impacted your respective movements for equality, for essentially liberation. I think India is in a particular is in a particular moment, let's say, because of the decriminalization a couple of years ago. And I don't know if that actually, if you feel a shift in the way that, like you're saying, you have been able to raise funding. I wonder if that would have been the case before decriminalization, or is that not necessarily the relationship? But the larger question is really what is the pandemic doing to your movements, in terms of, because we've all had to sort of shift away from priorities that we had before the pandemic. So what's happening to the agendas of your respective organizations? Vivek, do you want to comment on that first?
Sure. So at a point when we started, and I said earlier, that what I saw was that the LGBTQI plus was totally invisibilized in the larger narrative. From that point to today, almost 2 years into the epidemic, I feel that the situation of the pandemic has helped us uh, enhance the visibility. We really had to struggle. We really had to fight. We really had to make a noise. But no, we are not getting invisibilized. So there were like community voices, there were organizational voices, and also worked very well for us was that we had a dedicated team. And today we have, vaccines available, but when we started out, we had none. And we have a dedicated team of almost like 150 volunteers, including Hamsafar team members and across the country in 19 states, who have worked tirelessly, who have worked relentlessly, who have risked. Some of them also got diagnosed. I mean, they were also, they got COVID-19, because they were on the ground all that time, but yet they did not give up. And that kind of, became news. That kind of came into the limelight that, oh, there are communities out there who are supporting. And believe me, Amy, like, I'm very, very proud to say that not a single volunteer who's worked with us in this epidemic, across the states have asked for a single penny compensation. It comes from a passion, it comes from a sense of commitment that my communities need support. And they would actually say that, Vivek, I would like to go. Vivek, I would like to go. And we had these, transport companies who were transferring groceries. They say, I would take care of this location. I would take care of this location. And I think that really helped us push the envelope. And from total invisibility to, making the pandemic a part of our movement and how we forge forward, because now there is no running away. This situation is not going to go away immediately. So we have to make this effort that we are not getting invisibilized, because tomorrow it may be something else. So we are not letting the focus shift from us also. There are different communities, there are various marginalized groups, everybody needs, but LGBTQI plus also needs a space. And when one walks with that, yeah, we, in the end, like I was much more hopeful on the day one in March 2020, that yeah, we've really visibilized ourselves.
That's really interesting to hear. Leslie, would you like to comment on this? I mean, you have a very specific mission, your organization, and I'm sure you've had to sort of adjust to the current realities.
We can't move. We don't have funds. We ask for the government help, but they ignore us. We are a nonprofit organization. We do projects through fundraising, but we can't do it because the government is focused on COVID-19. But actually, the program with the government lacks program for the COVID-19, and also we can't go out because we are not fully vaccinated. We can't find help. We don't have access to social media because some of our members came from the urban poor areas. We don't have that load allowance. Actually, it's very difficult for us to access everything because we don't have it. We also ask help. We do ask help for fundings and for our projects, but we cannot. We cannot go to the government. We cannot go to the LGU because they don't provide for us. They don't have a project for us.
That's the local government unit, the LGU. Yeah. Mitch, do you want to weigh in, and then I see we have a question we can move to after you.
I think for us in Malaysia, yes, in the beginning it was all about advocating for legal gender rights, but there are opportunities within the challenges that we have. For example, like when we are providing provisions for the community, we know that they were not able to go to clinics for testing. So what we do is we provide community-based testing. We provide HIV test, hepatitis C test, and syphilis test. When they come to get the provisions, or when we go out, that's what we do, so that we are still providing them with some form of support with regards to their health. And when we give out the provision, it's about zero hunger for our community. So, and when we are collaborating with others, it's about giving others the knowledge and the information about our community and awareness, so that they are able to see us as no different, So I think that it's about, we should not wait for the sun to shine. We just dance in the rain, And that's where I'm coming from. Thank you.
I love that.
Love that.
Thank you. Let me turn to this question we have from an anonymous attendee. And they say, thanks for all the wonderful work that you're doing in each country. Can you all, each panelist, address if you also work with other community-based organizations in your country, region, or state to address the needs of LGBT plus people during the pandemic? In terms of getting resources and funding, are you cooperating or competing with each other? Interesting question. Who would like to start with that?
Should I go?
Please, Vivek, if you wish.
Yeah. So, interesting question. I'm very happy it came up. Humsafar is a model of partnerships. And not just in this pandemic, Humsafar continues to work with almost 110 community-based organizations across the country. Whenever we are writing for grants, uh, whether we need 5 partners or 50 partners or 100 partners, we go back to our CBOs, building their capacities, providing them funding support. But in this pandemic, what we saw was that the CBOs we worked with and the passion with which everybody came in, and the money was not just for us. It was like, so there were so many CBOs where, like, we couldn't we couldn't get grocery distribution, so we provided them money, and eventually they would give us a report about how they reached out. So working with CBOs, because at the end of the day, we are working with our communities. And as Vivek, as CEO of Humsafar Trust, I would see that all of us are working with communities, and we'd never, at least I would never compete, but complement and be there for our communities. That's our mandate. That's how we came into existence. Amy,
Sorry. After all these months on Zoom.
no, we all do it.
Leslie, would you like to comment on this question?
Actually, other organizations really help us because there's no one to help us. We do partnership with them without competition because not all organizations in the Philippines are registers and are registers and have the ability to create proposal. So we do partnership with them and ask for help for the other projects and implementation. Thank you.
That's encouraging to hear. How about you, Mitch?
It's the same as Vivek in Malaysia. I mean, we have demands from other states and we cannot reach out to other states. So there are CBOs over there that are our contact point that will give us the names and distribute the support that's needed. So at the end of the day, it's not about us, it's about the community. Thanks, Ami.
Yeah, that is really at the end of the day what it's about. We have just 5 minutes left. I don't see any other questions, so I would invite you each just to quickly, if there are any points that you would like to share that I haven't asked about that you feel would be important to share, please just take about a minute each to go ahead. Mitch?
Thanks, Ami. I mean, 1 minute. One of the things that I've learned throughout this pandemic was about being grateful. One of the greatest lessons I saw during this time was that all my teams are transgender persons, and we provide daily cooked food for about 150 to 200 a day. And we distribute it out to everyone in the surrounding areas. And watching from afar, a community that has often been ostracized, discriminated, giving out and providing food for them, for everyone to eat, was something that is so mind-blowing. Because in normal circumstances, the people that are receiving the food will be the ones that are discriminating against my community. So when I saw that, I saw how selfless the community, my team were in ensuring that during this pandemic, we leave no one behind. And I think because of that, the work that we do and the support from all funders, including Outright, it's not about survival, it's about living, good or bad, savor every moment, and be the best that we can be right now. Thanks, Ami.
Thank you, Mitch. That's very heartfelt. I really appreciate those words. Vivek, would you like to?
All that I would like to add is that this pandemic has brought communities together, that this pandemic has strengthened the bonds within the community at it once again brings me back from where we had started our journey decades ago, that marginalization brings us together, you know. And in India today, we stand at a point, we have got two progressive judgments and one act, the Transgender Act of India and the Supreme Court judgment that decriminalized homosexuality. It's kind of, in a way brought us together. We fight for our rights. We continue to struggle for equality. So even though, we've been decriminalized, but no, equality is still a distant for. But this pandemic has brought the communities together. So I would say, if someone were to ask me, did something good come out of the pandemic? I said, yes, it got us together. Thanks.
Thank you, Vivek. Leslie. All right, can you unmute?
Thank you. It's difficult to live in a pandemic country and in a government without support. We should continue to fight not only for equal treatment and benefits, but we fight to survive. We will use the support to continue and help each other, not only in the organization, but within the community. We want to live free. Even we are facing the pandemic, we want to live free without any hesitation. That's all.
And that is an incredible sentiment to end our discussion on. I really cannot thank you each enough for your participation, for your sharing of your stories and circumstances. It is an ironic moment that we're in where, while on the one hand, the pandemic has exposed such inequality and such gaps, I think, as Mitch said, but in support, and yet also has brought communities together in ways that is sort of unprecedented, I would say. So thank you all so very much.